A warm welcome to everybody joining us. My name is Glenn Little. I'm a clinical psychologist and convener of the e-psychology interest group with the Australian Psychological Society. In this session, we were fortunate enough to be joined by Dr. Ben Buchanan. He's a clinical psychologist, researcher, co-founder and CEO of NovoPsych. I've been meaning to catch up with Ben for ages. I was really impressed with the platform of NovoPsych in its user-friendly nature, its practical application. It's great. And he's got some really interesting reflections on what the future may hold for digital assessment and the use of technology in understanding our clients' experience to inform our therapeutic approach. Ben has a great mind. An introduction of Ben. Dr. Ben Buchanan co-founded NovoPsych in 2012 to help mental health services use psychometric science to improve patient outcomes. Ben champions human-centered software design, emphasizing that NovoPsych's central mission is to serve people, professionals, and patients. In Ben's role lecturing at Monash University, he grounds the next generation of psychologists in the scientist-practitioner model. He's a clinical psychologist himself, researcher in the use of routine outcome monitoring, and a leader in helping psychologists collect their own practice-based evidence. So here is Ben Buchanan. I was at a CPD event it must have been about a decade ago, so somewhere around 2013, with Dr. Michael Cargreg, and he was talking about iPads and use of iPads in schools. And I remember sort of towards the end, this guy at the back stood up and started talking about this online psychometric testing that was going on. And I remember at the time, I'm like, I'd love to have a chat to that guy.
Well, I think it's interesting that I remember that series of talk a decade ago where Michael Cargreg went around Australia talking about the use of technology in psychology. I suppose it's my central mission to harness the incredible power of technology and put it in the hands of clinicians, and so that we can improve outcomes for our patients. And for me, being a practicing psychologist as well, it's all about that. It's like, how can I empower psychologists to make a positive difference in their patients' lives?
Yeah, it's great to hear how that sort of anchors your focus with it. I'm sure there's been a lot of things over the years where you could go sort of this way or that way, but that seems like it's been, the thing that's held it together, just to have that as the guiding light going through. If I was coming to it from a blank slate, if I was approaching NovoPsych, what is it? How does it, how does it work?
The easiest way to explain NovoPsych and I suppose the value proposition for therapists is that it automates scoring for psychological assessments. And so, for decades, psychologists have been, let's say, giving their client the DAS-21, and then often in session, paper and pencil, then adding up the scores. What NovoPsych does is it essentially automatically scores it. But not only that, it also produces insights and metrics that you just can't get through manual calculations. And then if you do, say, administer the DAS more than one time over the course of therapy, let's say at the start, middle, and end of therapy, it will provide a graph for you so that you can graphically represent the progress of treatment over time.
Yeah, well, thanks for that. And it's good to get an understanding of of NovoPsych in a snapshot, concise form to see how it works. And I probably told you before I hit record on this, I was saying I was a bit of a fan of the graphical representations. It seems like that's a really great way. Maybe it's just the way I work, but certainly with clients and things like that, to step through it with them seems like a really good way of, that collaborative kind of process as well. So it's the platform itself seems really accessible. It might be a question that's pretty self-evident, but how does this help clinicians? How does this help researchers? How does this help the clients themselves?
In therapy, the first step that we do is really case conceptualization and formulation. Of course, in psychologists' heads, we've got a whole bunch of paradigms and theories, and the DSM sort of filed away somewhere in our brain that we can apply this theoretical knowledge to a client. And what NovoPsych does, it takes all of that theoretical knowledge out of a psychologist's head, puts it on into assessments, and we've got over 120 assessments now. So whatever framework or whatever sort of diagnostic paradigm we're thinking of, we can give it that assessment to a client and then get a more objective, systematic, thoroughly research-based
Mm, mm,
assessment
mm,
of where that client is. So an example would be like, if we have this sense that our client sitting in front of us is quite perfectionistic, we can explore that with them verbally and, do the whole talk therapy thing where we ask them and ask them questions. And that can be really helpful. But sometimes it's also really helpful to just get out a perfectionism questionnaire and say, hey, I'd like you to take this.
mm, mm.
And then they take the questionnaire. The score is, they're on the 99th percentile of perfectionism, and then that can be part of the conversation with them.
Mm.
So instead of just guessing about
Yeah.
where they might be highly perfectionistic, we
Mm.
get to test our hypotheses during a therapy session live and get their results instantly.
Yeah, I've found that really helpful as well, in the sense of stepping through sometimes particular items when you get the feedback from a particular measure, and it might say for someone that might not necessarily be as expressive early on when you're asking questions, it might be revealed that they might, if I think about something along the lines of like the DAS, it might have like a really high sense of worthlessness that you may sort of have not, they might not have disclosed verbally, or might not have sort of led you into that sort of feedback. And so to say, hey, look, it does seem like you scored, high on this sort of category, but then going back and looking at the specific item measures can then broker a conversation that might otherwise not have been had. Yeah.
Absolutely. And I think the other interesting thing is there's a whole bunch of evidence showing that particularly young people will disclose more in these questionnaires on an iPad than they will
Mm,
actually verbally.
mm, mm.
And the other thing that happens in the therapy room is that we want to be open and receptive and inquire and be a really great listener. But sometimes the advantage of a list of questions in a questionnaire can just be like boom, 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 getting through a whole bunch of things that it
Mm.
would take, you know, a 50-minute session to get through, because we want to be sensitive and kind in our interpersonal style. And a questionnaire can just do that just efficiently
Mm,
so that
mm.
us psychologists can maintain sort of the interpersonal focus.
Yeah, I think I'd imagine that a number of other clinicians have experienced this process where the first session you kind of 50 minutes to try to move through, or that type of thing, is you're trying to gather a lot of information to really develop a formulation in that way. And as you said, this can be a really great complement to that, and an efficient one. And if we're seeing clients through telehealth and things like that, I wonder if that's been part of your experience where the maybe upswing in telehealth, and the use of digital platforms. Have you seen the use of NovoPsych go up when people are maybe a little bit more familiar with technology? I mean,
But when COVID hit, particularly where I'm from in Melbourne, we all got locked down, and so we were doing sessions remotely where we'd just be sending links to clients for the assessments and doing it via Zoom, and the NovoPsych was totally set up for that and just made it really really easy. I mean, because our main competitor probably pre-COVID was like paper and pencil, right?
I think it also avoided the dreaded 2-3-1-2-3 in your mind when you're going down if you don't have one of the cover sheet reads for the DAS and things
Yeah.
like that. I don't miss that. That's for sure. It wasn't the
When was the
funnest
last
part
time
of it.
you hand scored an assessment?
Gosh, it's been a long time now. Oh man, I would say over 5 years, I think now, realistically. I didn't enjoy it, and it wasn't, yeah, it's not, I think I have a different set of skills than rather than adding up twos and threes for a really period of time to get through it. However, full respect to the measures themselves. You want to know the data and how it informs the formulation, as you said before. But yeah, counting through. And then I always make a mistake. You always say, hold on, this didn't add up. You always add it up twice, or maybe that's my own perfectionism coming through. Yeah. So it's as efficiency is a great thing with it. So, how does it work? How does this thing work?
So really, NovoPsych, there's 4 steps to it. So step 1 is clinicians select an assessment from NovoPsych's test library, and they can do it on an iPad, on their computer, whatever. We've got over 120 assessments that people can choose. And then the client takes it either on an iPad or their own smartphone. So you can like just email a link to the client's smartphone, or if you've got an iPad and they're in the office with you, you can just hand the iPad across. And then it will automatically interpret the results, and graph it and do a visual representation of the results. And that's provided back to the clinician, or there is a setting to provide it directly to the clients as well if you want it. And then the clinician uses the scores to track symptoms and provide feedback. The way I think of it is that it becomes part of the therapeutic process. That's the nuts and bolts of it. But let me just show you the list of assessments that we've got. There are many.
Mm.
We've got assessments for ADHD, for adolescents, anxiety, autism, child. Clinicians self-administer. Now, I reckon that this is really cool. Assessment that I encourage all psychologists to take is the professional quality of life scale, which measures essentially a level of burnout, another, psychological hazard of our profession. And it's got 3 scales in it. It's got compassion satisfaction, which is the opposite of compassion fatigue. It's got burnout and secondary traumatic stress. And so all things that, are hazards when it comes to working in this profession.
I do a bit of work with the emergency services, and this is a scale that's been really helpful and seems to resonate with them very well. I guess, secondary traumatic stress, things, vicarious trauma, or they might find themselves in these kind of situations. We're getting a gauge on that over time to be able to, and to rewind a little bit to what you mentioned before, having a conversation about those 3 aspects of professional quality of life ends up, generally in those conversations being a good conduit for the next discussion to say, okay, it does seem like burnout's pretty high. Your compassion satisfaction's low. Are you kind of feeling content in this role as much as you did when you started out? And that sort of gets them talking a little bit more, I find, in a helpful way, rather than, I'll be fine, just kind of keep pushing along, or just opens up some avenues of conversation. Yeah, that's great. And certainly good for us professionals as well to be able to use it.
Absolutely. And again, we've normed this against Australian psychologists, so you can see
Mm.
exactly where you fit
Yeah.
in comparison to other psychologists.
Yeah.
I mean, really, we've got a huge number of scales useful for clients, lots of outcome monitoring ones. And so the idea with these is to give it to our patients at the start, middle, and end of treatment, and then to track symptoms over time. And so, of course, with the DAS-21, which is really popular, provide a nice graph. And we tend to represent graphs in percentile terms. And so with this particular person, they're scoring mild in depression and severe in anxiety and stress. And then we graphically represent that as well. And with this graph, you can just show it to a client, and they'll immediately sort of understand that and feel validated by the fact that their problem is real.
And you find that the progress, having a metric for progress, particularly in therapy, it's not always as clear as maybe some of the more, with medicine, or classic example, I guess, with a physio, you can find it might be someone injures their elbow and their range of motion increases by a degree. You can check that out. So using these types of things, and this is not new in terms of the use of psychometrics, but the manner in which the information is being shared and communicated seems like it makes it really, as you said, efficient and accessible for patients and professionals.
Yeah, absolutely. And so that sort of graph, here's a representation of that. This is on a different assessment. This is an assessment called the Appearance Anxiety Inventory. And so with this is just dummy data, but the idea is that you would administer this over the course of therapy. And so this will be the first administration, and then you might administer it, once in the beginning, once in the middle, once at the end. And then it would just graph the results over time. So in this, it's pretty obvious that the higher the score, the more severe the symptoms. And you'd obviously be hoping that symptoms reduce over time.
I like the use of the colors within the graphs as well, just to kind of just make it more engaging. But as you said, just the efficiency of just being able to get a snapshot really quickly about what's happening.
Yeah. And you really want to be able to communicate with your clients in a really succinct way. And showing them a graph like that, it's just immediately obvious what's going on. And it's can be a stimulus in the therapy room to really celebrate some wins, celebrate the fact that they're getting better, or conversely, have a shared conceptualization of why things got worse. us human beings, we have some fantastic qualities and our brain does a wonderful job at many things, but having a really detailed memory of how
Mm,
we felt a month ago or a year
mm,
ago is not one of our
mm,
skill sets. Our psychologists can't remember how our clients were a year ago. The client can't remember themselves. Turns
mm.
out questionnaires remember perfectly. Yeah, I mean, if us psychologists stick at what we're really good at, which is the relationships, collaborating with clients, and then you can outsource remembering how they were a year ago to technology, then I think that
Mm.
that's fantastic.
We can outsource a little bit of hippocampal functioning to the to the data a little bit. I love it. Well, thanks, Ben. That's really helpful, and I think that gives you a great snapshot of how it works. Great to see not just the graphical representations, but I love that notion of the professional well-being associated with this as well. What do people like the most about NovoPsych? What are the reports back? That's like, yeah, everyone loves that. That's something, whether that be a scale or a function of it itself. What have you noticed over the years? People really take a shining
Um,
to.
people love the graphs. Yeah, people love the automated scoring. I mean, recently, for example, we updated a PTSD checklist.
Mm,
People just love the fact that you can give someone a questionnaire and then it will give you a whole bunch of it will check their answers against the DSM criteria and give you some recommendations about whether they meet or don't meet diagnostic criteria.
mm,
We've got some great personality assessments. People love them. But people really love the capacity to be able to reflect on their outcomes with their clients and celebrate those successes
mm.
through that graphical representation.
I love that. I think it's probably something that we try to engender the wins. When you're talking to clients, you're trying to maybe hold up some things and say, hey, look, I can recall 3 months ago when you said this. Like, this seems like you've been able to make meaningful. So that type of verbal reflection to them is one thing, but I love this idea of holding up something that is, it's not based on the friendly therapist interpretation. It's like, here are the hard numbers, like here are the facts of the matter here from what you've been able to. This is how you saw yourself or how you are feeling at this point from your own digital hand, I guess. And here it is right now. So yeah, a great way. I like that, being able to stand on top of the mountain together with them sometimes can be really handy, rather than just sort of feel like you're doing a bit of cheerleading. It's like, no, here's the real evidence behind it. What do you like the best? What's your favorite feature? Is there something that sort of stood out? It's like, yes, I love that. That's the best bit of this.
Yeah, I'll tell you what, this is something that we've been working on recently. So
Yeah, great.
this is using all of the data which is in NovoPsych to aggregate the data, have a data dashboard for how our practice is going in general. And so what we've done is my favorite feature would be this thing that we call insights, which is where you can look at your treatment outcomes in general. You can identify clinical trends. You can identify your strengths as a therapist, or if someone's part of a group practice, you can identify different team members' strengths and weaknesses, and you can do some really high quality clinical governance just by looking at the trends. And so some of the things that we find, and I'll show you this case study. This is my practice. So I have a practice called Foundation Psychology in Melbourne. And what we have done is we've used NovoPsych to collect DAS data and also client satisfaction data over the course of a number of years, just so that we can publish and be sure that what we're doing is being effective for our clients. And we talk a lot about evidence-based practice in our training and stuff, but what I'm really passionate about is collecting practice-based evidence. How do I know, as an individual psychologist or as a practice leader, how do I know that what we're doing is actually effective? We know the research might say things are effective, but how do I
Mm,
actually know? And
mm,
so with
mm,
this, we found at our practice, clients are typically satisfied. We found that the average reduction in DAS scores from the first session to discharge was from the severe range to the moderate range. And then we can, for all the stats nerds out there, we've been able to compute this as a Cohen's d, or an effect size. And so you can see that on average, clients that visit my clinic, there's an effect size of 0.81, which is more effective than the flu vaccine, double as effective as antidepressants for depression, and, ridiculously more powerful than paracetamol is for back pain. And of course, the only way we've been able to get these metrics is by routinely administering the
Mm.
DAS at the start, middle, and end of treatment, and then collating that data. And with this new feature that we've got out called NovoPsych Insights, it just computes it all for you. And the other thing is, 76% of the people that come in our door will experience a reduction in symptoms. And so that's my new favorite feature.
Yeah, it's
And
great.
something that I think is, incredibly powerful for clinicians and practice leaders to look at.
Great thing to be able to get a zoom out perspective and obviously informing things like culture or having a sense of real reward, to be able to sort of crank out the 76.1% at the Christmas party, and say, we're making a difference out there. We're doing well here. We're pushing. And I guess rather than to be left wondering, the process about being able to have that clarified or having some real sort of data to be able to bring that to light rather than a general sense that, yeah, I feel we're doing well, but, I'm not really sure. I'm not sure how that's tangible. Yeah.
And I think the other part of that is like everyone wants to say that they're, an expert in this or an expert in that. And, for example, for me, I was saying for years that I was an expert in body dysmorphic disorder. And, I did my doctorate in that. I studied it for years. And so I held myself out there as being, hey, I'm a BDD expert. But I never actually knew if what I was doing with clients was making a difference or not until I administered, I used the appearance anxiety inventory with body dysmorphic disorder patients and actually saw like that the effect size that I was having on clients was comparable to the published literature, and that is actually working. It is being reflected in the outcomes, which I'll tell you what was a great relief for me, because sometimes people with BDD are incredibly severe. They don't all get better, obviously.
Really interesting. It's talking to you today, there's more and more, I probably had some assumptions about what I thought we might talk about or what NovoPsych would
And
be,
you're
but
a
there seems
NovoPsych user. What did you think I was
I
going to talk
am. I'm a biased NovoPsych user. I guess for me, it's the user-friendly nature of things, being able to collaborate with clients, step through with them, and it being automated. So as I said, I'm not adding up twos, threes, ones, twos, threes all the way down the line. But I do find it very helpful, as I said before, the ProQual for emergency service personnel particularly. But how can we contact you? How can we get in touch? If there's people watching back on the recording, how can they get in contact with NovoPsych if they want to jump in and try out the product? How would they go about
just
that?
jump onto novopsych.com. You can sign up for a 15-day trial if you want, or you can get in contact with us. Or my email address is ben@novopsych.com. Nice and easy, just ben@novopsych.com. And I'd love to hear from you. And whether you're thinking about trialing NovoPsych or also existing users who are dying for me to put in a questionnaire or want something tweaked, always really keen to hear feedback as well, because essentially this product is here to serve clinicians so that they can serve their clients better, and the more feedback I get, the better the product I can make.
Yeah, that's okay. We'll get in contact with you, as you said, via the website. Certainly there's all sorts of information on novopsych.com.au.
Cool. Thanks, Glenn.